Hey, I'm Dr. Joe Niamtu, LoveThatFace.com. I'm a cosmetic facial surgeon in Richmond, Virginia. I do surgery from here to here, and I don't do boobs, bellies, or butts. I'm a teacher, I'm an author, and I'm a surgeon. So I have almost 24 million views on my YouTube channel, and I literally speak with patients all over the world. It's been an incredible experience, and I answer everybody that asks me a question. And it's time consuming, but it is very rewarding. And I just had somebody ask the question that they notice in some of my pictures that we don't use facelift dressings or drains. And I want to address this, okay? So for years, first of all, most surgeons use some type of dressing. Some use a big, almost wrapped up like a motorcycle helmet. Some use more simple dressings. And there's nothing wrong with this, and I did it for decades. But we do a lot of laser resurfacing with our facelifts. And even just a light laser resurfacing that can heal in a week can really improve your skin quality and make you glow. And that really complements the facelift procedure, eyelids, the procedures that we're doing there. And it's because you have that lasered skin, it's raw. And if you put a dressing on there, it's going to rub and abrade that skin. So, a number of years ago, we just quit using dressings on the patients that had facelift and laser. And then, that begs the question, well, why not just quit using them on all your patients? And we stopped. So we don't use dressings. When I say dressings, I'm talking about bandages or compressive dressings or Velcro jaw bras or that sort of thing. And it didn't make any difference at all. I don't think dressings have anything to do with preventing hematomas. They're uncomfortable for the patients, and they can cause problems. If they're too tight, they can cut off blood supply. If they're not put on correctly, you can have areas that pooch out, and patients don't like them. And so it's been kind of a nice thing, and we just don't use them. That doesn't mean that if your surgeon uses them that he or she is wrong, but it's worked out very well for us not using them, okay? Now let's talk about drains, surgical drains. So when you do a facelift, you're going to have, after you close everything up and put all your stitches in, you're still going to have some fluid under there. And there are doctors that use drains all the time. There are some surgeons that don't use drains at all. There's some that use two drains on one patient. There's some people that leave a drain in overnight, and there's some people that leave them in, 8 or 10 days. So here's my experience with that. And I've gone back and forth with this. I probably have videos that say I never use them and then videos that say that I use them. But we have, over the course of 1,700 facelifts, just like the dressings, we've kind of figured out that your average patient does not need any type of drain, okay? And what we do, one of the things that's really changed the game is tranexamic acid. And this is a drug that we give our patients in the tumescent anesthesia that we inject, the local anesthesia, and also IV for their surgery. And this really has cut down on bleeding, and it's very common. Many surgeons use it. And we just see such a smaller amount of bleeding that drains have just not been a necessity. When do I use them? Well, when you operate on a patient, some patients don't bleed much at all. Other patients have more oozing, not critical where you need a transfusion or anything like that, but they just bleed more. In a patient like that, then I might use a drain. And sometimes we just leave it in overnight. Sometimes we leave it in for a couple days. But generally, okay, I would say that 96 or 7% of my patients don't get drains and 100% don't get dressings, as I've just talked about. Now, if you don't use a drain, what happens if you do have a fluid buildup? Well, then you have to put a little needle in and suck the fluid out. You have to aspirate it, and we have to do that sometime. But drains can be very cumbersome. Patients don't like them. Staff doesn't like them. Doctors don't like them. Some patients need them, but I have found that your average patient for deep plane face and neck lift does not need a drain. So Everybody's different. Every case is different. I don't think any surgeon can ever say, well, I never, ever, ever do this, or I always, always do this. But since one of our viewers asked the question, I thought I would talk about it. If you have any questions about deep plane face and neck lift, eyelid surgery, facial implants, laser, brow lifts, uh, give us a shout. Our website is lovethatface.com. And thank you so much for the greatest gift of all, which is your time. I'm Dr. Joe Niamtu.